Pneumonia is a form of acute respiratory infection that affects the lungs. The lungs are made up of small sacs called alveoli, which fill up with air when a healthy person breathes. When an individual has pneumonia, the alveoli are filled up with pus and fluid, which makes breathing painful and limited oxygen is taken. It can be caused by bacteria, viruses, fungi, and aspiration of foreign material. The viral and bacterial pneumonia both are contagious. It can spread from person to person through airborne droplets, inhalation from sneezing or coughing, and it can also occur through coming in contact with someone with pneumonia causing contaminated surfaces or objects. For our case study, we have Mrs. Taylor, an 83-year-old senior living in an assisted living facility who had a 3-day history of progressive fevers, confusion, nausea, stabbing chest pain that gets worse when she breathes deeply or coughs, and vomiting. Her daughter reported that Mrs. Taylor had a sudden change in her mental ability. She also presents shortness of breath, lack of appetite, and experienced urinary incontinence. Mrs. Taylor enjoys gardening on Sundays as well as morning walks with her friends around her neighborhood, and she also enjoys cooking and playing puzzles with her grandchildren.
Pathophysiology of pneumonia. Variety of organisms leads to infection of the lungs, leading to different forms of pneumonia. Commonly, the upper respiratory tract infection or infection to other organs of body may lead to infection of lower respiratory tract. The most common type of bacterial pneumonia is called pneumococcal pneumonia, which is caused by Streptococcus pneumoniae germ that normally lives in the upper respiratory tract. Bacteria typically enter the lung with inhalation and through aspiration of contaminated food from gastrointestinal tract, whereas viruses and parasites enter the lung through the mouth, nose, or skin. Bacteria and viruses continuously being inhaled into the alveoli where gas exchange takes place. Once they reach inside the alveoli, they travel into the adjacent space between the cells. This process is called invasion, which triggers body's immune system to respond. The body's immune system responds by sending white blood cells, which is also called leukocytes, to attack on the microorganisms. The neutrophil, which is a type of blood cells, that is an important part of the immune system that helps the body to fight infection. So the neutrophil engulf and kill the offending organism, but it also releases cytokines, which is responsible for general activation of the immune system. This results in fever, chills, and fatigue, which is commonly seen in pneumonia. This inflammatory mediator causes the vasodilation that leads to increased permeability, resulting in accumulation of fluid in the alveoli. The neutrophils, bacteria, and the fluid leaked from surrounding blood vessels fill the alveoli and results in impaired oxygen transportation. This inflammatory response is the main reason for the clinical manifestation of pneumonia.
The clinical features of pneumonia vary from mild to severe depending on the factors such as the type of germ causing the infection, age, and overall health. Mild signs and symptoms often are similar to those of cold or flu, but they last longer. Some clinical features of a pneumonia may include chest pain when you breathe, confusion or change in mental awareness, cough which produce phlegm, fatigue, fever, sweating and shaking chills, lower than normal body temperature, nausea, vomit and diarrhea, shortness of breath, rapid swallow breathing, sharp or stabbing pain that gets worse when you breathe deeply or cough, and loss of appetite, loss of energy, and fatigue. For our case study, the clinical features that are related are fever, nausea, confusion, vomiting, sudden change in mental ability, shortness of breath, lack of appetite, urinary incontinence, and a stabbing sensation in the chest that gets worse when, in this case, Mr. Taylor breathes deeply or coughs.
Activity limitations specific to case study. Mrs. Taylor is experiencing urinary incontinence, meaning she is experiencing sudden and strong urge to urinate. So she needs to get to the toilet in time. And she is also experiencing shortness of breath, fever and stabbing chest pain, which makes her tired after taking a few steps. She would get out of breath after taking few steps. This will limit her activities like walking to and from the washroom and doing transfers like getting in and out of the bed. So basically her ability to move around in the house is limited. Activity limitation. Mrs. Taylor is experiencing sudden changes in mental ability which would cause confusion. Dressing requires cognitive skills like thinking, remembering, and being aware. She is getting confused when it comes to dressing. She would not remember what sort of clothing should go on first and which body parts should get dressed first. She would get confused to decide the appropriate clothes according to the weather and time. She might not getting the socks right way.
For the last activity limitation, Mrs. Taylor has been presenting confusion, which has reduced her ability to be independent, especially while she's bathing. While taking baths, Mrs. Taylor will not be able to differentiate which way the shower handle goes to control the water's temperature so she can burn herself or the water can be too cold. She also mixed her self-care products like her shampoo, her conditioner, and soap. And she also might feel unsteady regarding the silk surface, which will generate fear sensation because of the risk that she has of falling and getting hurt in the shower.
Participation restriction. As Mrs. Taylor is 83 years old, retired senior who is living in assisted home facility with her daughter and grandchildren, she enjoys gardening on Sundays. But because of experiencing shortness of breath, fever and chest pain, she would not be able to do gardening. Gardening includes watering the plants, digging, picking the flowers and planting vegetables. All these activities make her more tired, which would restrict her participation doing gardening. Participation restrictions. Mrs. Taylor likes to enjoy playing puzzles with her grandchildren. She is experiencing confusion because of lack of oxygen in the brain, which restricts her ability to play puzzles with her grandchildren. Playing puzzles require attention and concentration. She is getting confused, so she would not be able to pay attention while playing, as well as she would not be able to use problem-solving skills and thinking skills by moving or rotating a piece of puzzle.
For the last participation limitation, Mrs. Taylor enjoys taking morning walks with her friends around her neighborhood every morning. Mrs. Taylor has been experiencing fatigue after a couple of steps, and her breathing gets heavier, generating a stabbing pain sensation in her chest when she goes out for a walk with her friends, especially when she's walking uphill streets. Since Mrs. Taylor is not able to tolerate this physical activity, which is walking for a long period of time, due to her chest pain sensation, she won't be able to take daily walks with her friends for longer than an hour.